newly established dedicated mental health clinic at Mpilo Group of Hospitals in Bulawayo has provided a vital launchpad for Zimbabwe's response to the escalating challenge of drug and substance abuse. Let's take a look at the following.
Zimbabwe has, over the past few years, seen an increase in suicidal cases, with children as young as 10 years old seeking to end their lives. As a result, health institutions have been overwhelmed by mental health illnesses, with untreated depression and substance abuse being the leading cause. In March last year, it was reported that Mpilo Central Hospital in Bulawayo recorded a 245% increase in suicide attempts. The hospital has since intensified clinical services to give specialized treatment to patients battling with mental health issues.
We are looking at someone who will have behaved in a way which is normally not usual for a normal person. Then we think there must be a mental problem somehow. So you find that in our case, we are getting people who some are actually not well people, isn't it? Then they are on treatment.
The clinic seeks not only to treat patients with such challenges, but to also bring awareness to neighboring communities.
And also, they've got a program where they actually do outreach in conjunction with the PMD Bulawayo, where they go, they reach out for people in schools and in these other places like Ngozi Mine, they do some outreach. That sensitization is making people understand the impact of, say, drug abuse or these attempts to take one's life.
A mental health expert believes self-care is one of the most important ways to preserve one's mental health.
You're supposed to eat healthy, and you should look for professional help if you are in need of any, and do not use drugs or alcohol to cope with stress. We encourage them to come to us and we do counseling. Talk about your feelings with someone you trust and get 8 hours of sleep every day. You should enjoy walks with your family and friends.
The drive has come with its fair share of challenges, but the hospital is determined to play its part in fighting this challenge.
Most of the clients fail to come back for follow-up visits, and they can come initially and they just go. At times we call them from our cell phones, and which is expensive, and plus we take into consideration that counseling and one has to seek counseling and has to be willing, and because if you keep following on them and to come for counseling.
This initiative will see the breaking of new ground in mental health awareness. It's a mammoth task for the institution, but a good step into a drug-free future.
I think as we get into 2025, I think one of the things that we want to be intentional about is putting a spotlight on mental health issues. And I think one of the links that I liked from the nurse that was interviewed in that report there was the issue of self-care. I think that's the biggest thing that we have in control. But when you have challenges with that self-care, it's important to find someone to talk to. More significantly, it preferably should be a mental health professional. I think as Zimbabwe, sometimes we've put mental health issues on the back burner. And Chief, you were saying something when we were off air about visiting a mental health facility during the holidays.
Yeah, there's the famous Ngucheni Hospital. It's a psychiatric unit, for Bulawayo, and it's been servicing quite a bit of people. And unfortunate incidents of drug abuse as well, which are unfortunately on the rise, and that has also increased the number of, I don't know, the intake, or people who are there within that hospital. There's plenty of them now, but that has also had its effect on service delivery. I was there. The nurses are absolutely amazing, but they don't have resources. And I think this is my clarion call also to the Ministry of Health and Childcare to revisit that particular institution and see these people who are there, are they being taken care of well in terms of the resources, the kind of food that they're eating. Teach, you will not like it at all. And I think nobody deserves that, even in their dire state, in that kind of ailment, as it were. I think they deserve better. We should actually work towards making sure that they are safer. So it's great to see this one opening, but my fear is also, again, resources and their allocation to those particular institutions. They need to be really looked at seriously. Ngucheni is a definite dire situation that the Ministry of Health must urgently attend to.
And I think not that clarion call, Koti, is just not for Ngucheni, it's for everything, even if it's a mental health institution or just a clinic, our basic clinics in the rural areas. Because I was speaking to my maid, she went to Kumusha for her holiday, and then she says her son got really, really sick. And then I said, doctor, because all you get given is paracetamol, because nothing is happening there. So I think it's a clarion call for not just mental institutions, but for every kind of health institution, healthcare situation, for children, for adults, for mentally incapacitated people, for everything. Just across the board, we need to do a better job of making sure that our institutions are taken care of.
Konapo, ipapo, ba ZTN Prime, DSTV channel 294, the place to be.